Well, good evening, everyone, and welcome to our third 6 at 6 of the season. I'm Mark Nykirk, the director of the Scripps Howard Center for Civic Engagement here at NKU. Our office works to connect the campus and community, and this community lecture series is part of the way we do that. We are a hybrid event this evening, so we have a live audience in the studio in Griffin Hall at NKU, and we are also happy that you are joining us virtually. And if you have friends who missed it, these are archived on the 6 at 6 website, so visit us there. Thanks to the miracle of YouTube, we live forever. I want to remind all of you who are watching virtually that there is a Q&A function at the bottom of your screen. Our speaker this evening will talk and then answer questions at the conclusion. Just put your question there, and we will monitor those. Those of you in the live audience, in-person audience, if you have a question, you just need to raise your hand, and we will, Cecile will answer. I remind everybody also that we're going to take a break after this and be back after the first of the year for the next 6 at 6. It is on January the 18th, and Stacy Jankowski, who teaches communications, will be talking to us about political memes and how they are being used effectively or ineffectively in political campaigns. I've seen a little bit of that. It's pretty entertaining, so please mark your calendar for January the 18th at 6 p.m. Also, this week, this lecture series is designed to showcase the scholarship and research creative activity of our faculty and students. There's something else happening this week that's in the same vein, and that is that 5 of our faculty are participating in a national podcast called Academic Minute. And so all week, Monday through Friday, a bit of research by NKU faculty is being sponsored on the national podcast. Some NPR stations cover that also, so you may hear it on the radio. But if you Google Academic Minute NKU Week, you will be able to listen to those on demand, so we invite you to do that. I would like to introduce our speaker tonight is Dr. Cecile Marczinski. I did so well in rehearsal, you know. Sorry about that. And actually, this is her second 6 at 6. She was with us, I think, a decade ago, talking about some research that she'd worked on that had to do with energy drinks and alcohol, and how the drinks accelerate the effects of alcohol. And some work that had been done in the lab. But tonight she's going to talk to us about a very timely topic that I think we can all relate to and have had a personal experience in here in recent years, unfortunately, and that's what do we think about vaccines, and should we get them, and why or why not, and what do people are telling the researchers about that. So, Cecile, welcome.
Thank you. Thank you, everybody, for being here. I wanted to talk a little bit about the psychology of pandemics. My interest in this has been, it has been something that I've been interested in a while ago, and then I sort of got away from it, and then with COVID-19, I got interested in it again. But I thought in this talk it would be worthwhile to just kind of talk a little bit about the university experience in COVID, to place all of this in context. Since it's a community engagement lecture, so there may be some people who kind of want to know, what it was like to be in a university during this massive disruption. And then I'll talk about 2 research projects, one that was from 10 years ago, and then one very recent, and then talk about lessons learned, and open it up for questions. So to first start off, it's an understatement to say how disruptive COVID-19 was to our society. And in education, everything that we do is so in person, and really trying to connect with our students. So it was particularly disruptive to education. And in March of 2020, we thought we were just going to go home for 2 weeks. That was what we were told, just stay home for 2 weeks and teach online for 2 weeks and it'll be fine. And very quickly, people began to panic, the great toilet paper shortage of 2020. I'm trying to bring back memories of that time about the panic that we felt, the great uncertainty that we felt. We were told that it would be very time limited, and look at where we are, well over 2 years, and we are still dealing with COVID. The disruptions in education were largely, we could not be in the same room with other people. We had to stay away from each other. We didn't have vaccines. So everything that is important to students and faculty at a university, couldn't happen. We had to stay in our houses. We didn't have student events. The technology that we are so used to that happened so quickly, we didn't know what Zoom was. We didn't know how to record a Zoom lecture. All the things that we quickly learned how to do in a very short period of time didn't exist. And during that time period, we felt tremendous uncertainty constantly. We had no idea what was going on constantly. We were looking to authority figures to give us some direction and certainty, and none of that was happening. And education was disrupted in higher ed, but it was also dramatically disrupted at the elementary school and high school level. And parents learned very quickly how horrible it is to teach kids at home. Developmentally, kids aren't used to sitting in front of a computer screen all day. It was just horribly disruptive. So now that you feel full anxiety and panic about what it was like, because it's all coming back to you now, I think it's worth, looking into literature and thinking about time periods where, there is massive disruption. The French Revolution is one that was Charles Dickens wrote about in A Tale of Two Cities. And I think, the passage, it was the best of times, it was the worst of times, it was the age of wisdom, it was the age of foolishness, et cetera. I'm sure many of you are familiar with the opening of that book, but that really is true. When there's crises, there's horrible outcomes in that crisis, but there's also great things that come from it. So I think it's worth just, thinking about that for a moment, what happened. So I was a department chair during that time. The Department of Psychological Science clearly had some worst of times. We went from very engaging in-person classes where faculty are loved by students and they want to be there, and suddenly none of that could happen. 95% of our classes were online. All the other things that we do for students also couldn't occur, like the experiential learning that we know is so critical to the development and success of our students. Like, companies just did not want face-to-face internships. All that human subjects research that students do to learn how to do research in psychology was completely impossible. We had a trip planned to Italy in the spring of 2020, and 30 students were very, first of all, they had tremendous uncertainty if the trip would go, and then eventually it was decided by the university that no study abroads can occur. And to this day, our department still has not had a study abroad go yet from our department. So these disruptions not only occurred at that time period, but have persisted, and we're slowly trying to rebuild, but it has not happened easily. The faculty were extremely overwhelmed with teaching the majority of their courses in a brand new format. There's faculty in this room who probably have horrible memories of trying to teach awful courses like research methods for the first time in an online format that just is not well suited. And so, it was awful in some ways. And the students also gave negative feedback. They felt like there was no engagement. They were tired of being on Zoom. They had too much work to do in online classes. They didn't feel ready for the job market, and they were correct, because all the things that we encourage our students to do to get ready for the job market, they were blocked from doing. And they basically felt alone and very hopeless. But at the same time, I think it's important to emphasize how incredibly successful the university was in managing this crisis. And one of the things that I would say is that students were asked on course evaluations, students were asked in surveys in our department globally about our department, about how things are going in these online classes. And when students filled out course evaluations, they were extremely positive. they recognized that our, faculty were, dealing with difficult situations, but they also commented how the faculty really stepped up and were really excellent in teaching in this brand new way. And I think that, so we had in our department like a 4.6 out of 5 on all, across an average of all our course evaluations on instructor effectiveness during the next academic year, the 2021 academic year. And I think what happened is that NKU at that time period deeply invested in the well-being of the faculty and saying, you know what, we are asking you to do something that is pretty impossible, so we will give you the professional development so that you can do this. We will give you the instructional designers to help you manage all these technology things that you're unfamiliar with. And when we deeply invest in faculty, the faculty rise to the occasion despite all the personal chaos they were also dealing with in this crisis. And so I think it says a lot about the decisions that the university made at the time to support faculty, and investing in faculty is always a good decision, I think, because always students benefit. And so I think faculty, we have to say a few things about faculty. One of the things I would say about faculty is that we talk about a very highly educated group of individuals who are quick learners and who are trained to be comfortable with complex problems and ambiguity. They are also deeply invested in teaching and the success of our students. And so even though circumstances were incredibly unpleasant and have not returned to normal, faculty are the ideal group of people to be in charge in this kind of situation. So you can tell I'm kind of pro-faculty. Can't wait to go back to faculty after I've done my chair term. Okay, so in the beginning of the pandemic, we were in this total panic because we did not have vaccines. And the thing that we were waiting for was a vaccine so that we could get back to normal. Right? Until then, we could just wear masks, stay apart. But once we had vaccines, we were like, life will get back to normal right away. And one of the things that happened is that, yes, vaccines became available, but the uptake of vaccines actually was rather slow. Part of it is that there is known to be a continuum of vaccine acceptance in society. There are some people who are very comfortable taking the word of scientists and physicians, and they trust that information, they accept all vaccines. But on the other end of the spectrum, you have people who refuse all vaccines, and then people all across the continuum. Vaccine hesitancy is not uniform across the United States. I'm probably telling you something you don't already know, but this is CDC data on vaccine hesitancy. They've asked across the United States, people who feel comfortable with vaccines or feel hesitant, and a quarter of the population in Kentucky still feels fairly hesitant about vaccines, whether it's extremely hesitant or just hesitant, but they still have some uncertainty. So that's 1/4 of the population. And when you ask people today, or I should say in September when people were asked, how has COVID-19 changed the world, they'll say things like, well, 88% of people will agree with the statement that COVID-19 changed Americans' lives forever. 85% said we'll never fully be rid of this virus in my lifetime. 82% are sort of positive in the sense that they'll agree with the statement like we are in a better place than we were a year ago when it comes to COVID. And 3/4 of the population believe that the pandemic-related shutdowns in early 2020 were necessary to save lives. So despite a lot of media attention suggesting that people were not aligned with these shutdowns before we had widespread vaccines, the majority of the population agrees that we did the right thing at the time with the information that we had until we could get vaccines. But life is not back to normal. So if you look at current data in September, we still have a lot of Americans who are worried about COVID, sometimes wear a mask outside the house, and that probably will increase as we go into the flu season. And some people have returned to full normal post-COVID lives. Other people are still, hesitant into returning to normalcy. Going into this fall, we're still into the winter, we're still a little uncertain how COVID is going to function this winter season. So it took a while. Now 80% of the population across the United States has at least one COVID-19 vaccination. But it took a long time to get to that point, much longer than anyone probably would have predicted. But if you look at the literature, should we have predicted this widespread vaccine hesitancy? And the answer is a resounding yes. You know, you can just look at literature on other flu vaccine uptake. 10 years ago, I was working with students in my lab, and that's when H1N1 became pandemic level as a virus. And so I actually did a study at NKU with Megan Ramsey, who was one of my students at the time, and I said, you know, H1N1 is spreading. College students are particularly susceptible to H1N1 because college students had never been exposed to a virus that is similar to H1N1. Older adults had been, but college students had not. So that age group, that young adult age group, was particularly susceptible. And so we said, you know, let's look at, you know, if they're interested in getting the vaccine that was immediately available for H1N1 to protect them from getting sick. And they were getting quite sick at that time. So first I'll show you reasons for refusing that vaccine before I tell you how many actually got it. So the reasons for refusing the vaccine back in that data set from like 10 years ago are the reasons that will look very familiar to reasons why people didn't want to get vaccinated for COVID. They said, it won't work. There's not been enough testing. That always is a resounding answer. They give other reasons. They're worried about side effects. They worry if they're going to get the H1N1 flu, which is, you know, they don't understand how vaccines work because you can't actually get the flu from the vaccine. And so a lot of those reasons are the same reasons that people during the release of the COVID-19 vaccines were saying, I'm not going to get them. When we had a subset of students who said, we will accept the vaccine, or we're planning to get vaccinated, or I already had gotten the H1N1 vaccine, so we asked if they got the regular flu shot and then the H1N1. And so they said, reasons for getting it: I want to avoid getting H1N1, I want to avoid illness, I think the vaccines are safe. You know, those sorts of things that you would hear from people also today when they say, why did they get vaccinated? But I think the biggest important data from that data set, from all those students, these NKU students, is that only 16% of the participants in that study were planning on receiving an H1N1 vaccination. And that's pretty much what you would expect if you look in the literature on vaccination rates. Flu vaccine uptake, will vary from year to year. If it's a really bad flu year, you'll have better vaccine uptake. But when vaccines are not mandated, the numbers are low. And sometimes they're hesitant about the vaccine. Sometimes they can't be bothered to get one. There's lots of different reasons. But in these young adults, 16% was the number. And when we asked them, a question about were you at risk for H1N1? Do you feel at risk? Are you at risk? They're like 30% said, no, I don't feel like I'm at risk. Even though there were many media reports at the time that it was young people getting sick because they didn't have that protection from exposure to that virus many years ago. Interesting change from maybe today is that many students on our survey said they would go to class if they had influenza and were sick. That, I think, is a change, because I don't think students today would go to class coughing, sneezing. Today I think there's sort of this virus concern that, going to visibly sick to class would be not something you do anymore. But 10 years ago, students routinely were like going to class sick. So that has probably been a change. And then the vaccine's safety, effectiveness, and side effects, those were the things that people were worried about. And then if a doctor recommended a vaccine, if they'd had a previous vaccination, recently for a flu shot or other vaccinations, they were more likely to say that they're going to get vaccinated. If they're high risk, they would be more likely to get vaccinated. But in the abstract of the paper I wrote at that time, our findings suggest that college students are inaccurate in assessing their risk level and are unlikely to seek vaccinations. So I think going into COVID-19, we had concerns about getting students to get vaccinated. Okay, so since that was from 10 years ago, and I did a 6 at 6 talk 10 years ago, I thought it would be kind of interesting to see where these students are. So Megan Ramsey, who is the co-author on that paper with me, there's pictures from the lab in 2012. These are actually pictures from my last 6 at 6 talk in 2012. It was at the Behringer Crawford Museum. And so those are two students you kind of wonder, well, what do these students do when they, get their degree and where do they go? Well, actually, they've had pretty good careers. I'm pretty proud of them. So Megan is now Dr. Megan Ramsey. She completed her PhD in psychology at the University of West Virginia, and now she's a senior grant writer at the University of Michigan. And then Amy, who's the other student in the picture, completed her PhD in psychology from Old Dominion University, and she's now an assistant professor at the University of Rhode Island. So, those high-impact, I know, isn't it? It's so great. Those high-impact practices of working one-on-one with students, they matter, because students go great places when they work with faculty one-on-one. So, it's really important that we protect that, and we encourage that, and we value that. Okay, so back to vaccine hesitancy in young people. So young people don't feel like they're at risk to getting sick, injured, that's just, the demographic group. And so the data on vaccine hesitancy that I collected 10 years ago makes perfect sense in that context. It also makes perfect sense when you think about brain development. So the brain actually continues developing until about age 25. The part of the brain, the prefrontal cortex that is in the front part of the brain that is the last to develop, is also the part of your brain that weighs the long-term consequences of actions. It helps you control your impulses, but it also helps you plan and think through your decisions. And so it makes sense that that age group is not the age group who thinks really carefully with great, weighing of the, should I get vaccinated, should I not? What happens if I get sick for 2 weeks and I have a missed class or work or I miss, holidays or whatever? That part of the brain is not fully developed, so they wouldn't be good at assessing their risk. The other lower brain areas are fully developed. The parts of your brain, the lower parts of your brain in the center of your head that are part of motivated behaviors, they're in place. So, young people want to have fun. They want to have a good time. They don't want to think about, how they can prevent getting, illness by a vaccination. And just a little detour, that part of your brain is also the part of your brain, because this is where my interest in risky behavior came from, is looking at the effects of alcohol. Alcohol affects that front part of the brain first as well. And so, that's how we know that front part of the brain, is really the part of the brain that, as well as brain imaging studies, that controls impulse control, but really helps us weigh the long-term consequences of actions. And Dr. Perry-Lou Goddard is in the audience. These are her slides of these pictures. They are so excellent that I continue to use them. I should really give her credit on this slide. But anyways, here's a picture of the brain. It's actually your side of your head with the side cut off. And so the center part of the brain is the go part of your brain that really motivates you to do things and respond to rewards. The prefrontal cortex where your forehead is really the weighing of consequences, thinking through decisions, that part of your brain that is not fully developed. This is why we don't let, kids sign cell phone contracts for, cell phones or something like that. Because, the part of their brain that allows them to weigh the decision of signing a contract, it's not fully developed, so we don't let them do that. That's why, it's based in, brain development. So if that front part of your brain is not working that great, for whatever reason, you're not fully developed yet, then you're gonna have trouble with self-control. You're gonna be, thinking through things not as clearly, but also long-term consequences. And so, it's the idea of understanding self-control is a real big theme in psychology because it underlies good choices and strong behaviors that humans really struggle with. We struggle with, not eating bad foods. We struggle with not drinking too much. We struggle with all kinds of things that involve self-control. Now, the one thing that has changed, I think, since I first did the first study, is that kids are now exposed to this neuroscience content, which is really kind of amazing. Like, if you go into an elementary school today and you ask kids if they were paying attention, they would probably, if you said, "Why are you having a meltdown in class? Why are you so upset?" They'll say things like, "Oh, the amygdala part of my brain is on fire and my prefrontal cortex isn't working." And they know that stuff now because they've been taught this in school. And so this teaching of neuroscience so they understand self-regulation has totally changed. Because I think 10 years ago, we didn't know that at all. And so, again, this data explains things like, why are young people more likely to binge drink? Why are young people more likely to get into accidents and injuries, like drive while impaired or get into injuries and things like that? So, that demographic group, it makes total sense that they would also not be interested in doing preventative medicine like vaccinations. In 2012, I also wrote a review paper because I really got interested in this topic, and I was thinking, oh, is it just young people that are vaccine hesitant, because of the brain development and that sort of thing? And the answer is, well, no, not really. Vaccination in a pandemic, H1N1 became pandemic level status around this time. And so in a pandemic, it's the vaccination that gets us out of the pandemic. It limits the mortality, the morbidity, so that we can get back to normal lives again. But when you look through the literature and you look at the vaccination rates of all kinds of demographic groups, it's not just the young people or the college students who aren't getting vaccinated. It's groups that you think really should, like pregnant women, healthcare workers. Healthcare workers are surrounded by disease all the time. They should really be the ones that step up first, right? Childcare workers. If you've ever been in a childcare setting, you know that it is just disease central. They're passing along the bacteria and viruses everywhere. Those should be, individuals working in those settings should be the first to get vaccinated, but that's not the case. And the general public, of course, as well. And so there's common misconceptions, doesn't matter what, research study you look at. It's very common that people will report, oh, I don't need this vaccination. Like if you're a healthcare worker, you need the vaccination. But, they say, oh, I don't need it, or it doesn't work, it's not efficacious, or it's not safe. Despite being trained in science, Okay, so now let's fast forward to the data I collected very recently. So Carly was a student of mine last year, and Carly was interested in doing an honors in psychology project, and she came and talked to me, and she's like, what can we do for this project? And I said, well, what do you want to do? And she's like, I don't know, like COVID has ruined my college career. I said, well, do you want to do some research related to that since you had your college career experience ruined by COVID? She's like, okay, fine. And, and initially she wasn't super enthusiastic about the idea, and then she really got into it because she saw the value of doing scientific research to answer questions. And so I said to her at the time, look, I collected this data 10 years ago, it's likely that not many students have gotten vaccinated. Let's find out. It's probably because they're, amenable to all kinds of risky behaviors. So let's see if it's related to drinking and do a measure of risky behavior, which is a sensation-seeking scale. And so we said, these things probably all go together. Young people, they engage in risky behavior, they drink a lot, and they are probably vaccine hesitant. And so there's a picture from our department Instagram page. She now works for Cincinnati Children's Hospital as a researcher. So she liked to research enough with me that she kept going in research. Okay, so just a little bit about NKU's approach. Every university had a different approach to COVID. We did not have a vaccine mandate. We did not require even employees or students to report on their vaccination status, but we did encourage them to do that. So we have my NKU, an internal system where students or employees could go in and say, yes, I've been vaccinated. In that system, there were very low rates of vaccination reported, and then at a certain point, the university just like took that system away. So they're like, we don't want to know, just don't tell us. Okay, so going into this study, we really didn't think there would be high vaccination rates. We did know during COVID from national data sets and some smaller studies that people were drinking a lot more during COVID. The social isolation, the stress, led people, the boredom, all of those things led people to drink a lot more. And so the long-term health implications of that is still relatively unclear, but what we consider healthy drinking, it's always useful to kind of say to people, because a lot of people don't know what should be, the sort of the way that you decide to stay within a healthy alcohol consumption level. And so, men shouldn't be drinking more than 14 drinks per week, women no more than 7 drinks per week, and then on any single day, men no more than 4 and women no more than 3. So, all kinds of studies were suggesting people were vastly exceeding these guidelines, and alcohol sales were also way up. So we knew that, it wasn't just, people saying they were drinking more, like the consumption was also economically observed. Okay, so in this second study, we recruited, again, college students, mean ages 21. Our sample size was a little smaller, but it was challenging to do research, and we were pretty happy with that number of subjects. That it's smaller than the other study, but it's still a relatively decent number of participants. When we asked students, were you vaccinated for COVID? At first I thought Carly had coded her data wrong, because I was like, that can't be right. But 82% of our students said they were vaccinated. And I was kind of shocked, because if you recall, if you remember from earlier, so 82% last year said they were vaccinated for COVID, at least one vaccination. It didn't mean that they necessarily had a booster and everything, but they had at least one. That's a complete reversal for what we saw during H1N1. Complete reversal. Remember, NKU did not have a vaccine mandate. We did not require people to disclose their vaccination status. The interesting thing, too, is that H1N1, the young people were particularly at risk during that time period. Older adults less so, because they had been exposed to those H1N1 related strains before 1957, and so they weren't doing so badly. But during COVID, there was a higher death rate by far. It's been the worst pandemic in over 100 years. Older adults were particularly at risk, but young people, like generally, unless they had a pre-existing health condition, were not doing too badly. A lot of them were asymptomatic carriers. So this data was very surprising. So it lends the question of, have our participants changed in only 10 years? What's going on here? So one possibility that I think I'll entertain is the idea that the students that are answering the question last year were in Gen Z, and other studies have shown that this demographic group is risk averse. They have lower levels of alcohol consumption. They still use alcohol somewhat. They still will, use other illicit drugs somewhat, but the rates of alcohol consumption are lower than has been true for other groups. They have a lower rate of teenage pregnancies. They're more concerned about academic performance. If you give them a task about delaying gratification, they're better at it. They're more likely also to have other things. They have more mental health disorders, more likely to suffer from anxiety or major depression. They are more likely to spend time with parents and family, but a little less time with peers, and they tend to a lot of times report things like they feel social anxiety around peers and things like that. So they're worriers, and they don't take risks. And so, maybe that makes sense. Some of this data came before COVID hit, but some of the data during COVID makes perfect sense. The world was in a panic. We are totally just amygdala flaring up constantly for very long periods of time. No wonder young people worry. Everything has been worry for a couple of years for them. and a really critical time period of development where, they should be having fun and going to parties with their friends, and instead they're worrying about, grandma dying from COVID, and, so many things are going wrong. So just to, make sure that there isn't weird things about this data set, because you always have to worry about that. This is a scatter plot depicting the correlation between vaccine hesitancy scores and sensation seeking. So first of all, we wanted to make sure that we had low vaccine hesitant people, high vaccine hesitant people across the board. We did. We wanted to make sure that we had people who are, more likely to take risks or less likely to take risks, high and low sensation seeking, because that personality trait has some genetic contribution. And so we want to make sure we have all kinds of variation there. We did. All those dots are one person's score on those measures for each measure. You can see there's no relationship. High risk takers, low risk takers, not related to vaccine hesitancy. When we looked at high and low vaccine hesitancy and alcohol use, this is a scoring measure looking at if they're drinking problematically, exceeding guidelines, and starting to have symptoms of an alcohol use disorder. You can see, again, we had people who drank almost nothing, but drank a lot, almost in the risky territory. Anything 8 or above on an audit is a hazardous drinking. So we had plenty of people who said that they were, hazardous drinkers. But again, there's no relationship between the vaccine hesitancy and the audit scores indicating alcohol use disorder. Now, in the prior literature, many, many times before, it's been shown that sensation seeking or risky behavior and alcohol use disorders go together. In this data set, we did find that. So that would be expected. That would be a good manipulation check to make sure that the data isn't really strange, because let's recall that the data didn't make sense with what we collected 10 years ago at all. And here you can see that the sensation-seeking scores, as they went up, if the person is more interested in risky behaviors, they were more likely to score as problematic drinkers, and that correlation was pretty consistent and statistically significant. Also, just to make sure our vaccine hesitancy score scale was measuring what we thought, we should have vaccinated people say, I'm not as hesitant. You should have unvaccinated people say, I'm more hesitant about vaccines, and we did see that very clearly. There's a very clear distinction between vaccinated people feeling less hesitant. So again, another manipulation check that our data was not just some weird finding of people not answering the questions or not reading them or something like that. So summarizing just briefly that study, there was no significant correlation between vaccine hesitancy and sensation seeking or risky drinking. As expected, you did see the correlation between sensation seeking and risky alcohol use. That's been seen in many other studies. So if we didn't see that, we'd think that there was something odd. So that was good to see. And then risky drinking, sensation seeking, no relation to vaccine hesitancy. So I don't know, maybe these, two studies have uncovered a societal change in our young people that researchers, should pay attention to. Now, that young people group that is more anxious, more risk averse, has that also occurred in the whole population? I didn't collect data on that, but I can show you that yes, that is very much true. So if you look at, this is data from the CDC, if you look at the number of adults reporting symptoms of an anxiety disorder or depressive disorder pre-COVID, it was around 11%. That's been fairly steady over time. And huge jump up once you took data from January of 21, 40%, almost half of the population. And young adults are suffering the most. When you look at anxiety and depressive disorders during COVID, more than half of young adults have symptoms that indicate a disorder. So it's not just they're feeling a little anxious, like they would qualify to screen positive for a disorder that would, we would recommend treatment. So these are really, half of the young people are really suffering. And so the whole population is suffering, but young people particularly have taken the brunt of it. Is it just the United States? No. Here's the UK at the top and the United States at the bottom. The UK data before COVID, about 10% were showing signs of mental distress and 11% in the US. That jumped up for the UK, but way, way worse for the United States. And the United States, if you look at global data, the United States has the highest rate of mental health disorders. You're actually better off being in a low SES, low-income country. You'll less likely to have some sort of mental health disorder than the United States is the worst. And you think, wow, it's just mental health problems. Like, what's the big deal? Well, the problem is the mental health problems tie to all kinds of other physical problems that can be very detrimental to individuals or even fatal. So, stroke, heart attack, heart failure, cardiovascular disease, metabolic disease, on and on. All of these things are connected because when your body is constant, like for example, anxiety, if your body is constantly in a fight or flight response, that's an unnatural state for your body to be in, and eventually, you're going to have damage to the body. For depression, there's very good evidence and studies that chronic depression will result in neuron damage in the brain. So the list goes on and on about the physiological ramifications of these serious mental health disorders. So some initial thoughts. Vaccine hesitancy is less likely to be an issue in young people if the messaging is correct. Obviously, we did some things right in COVID because our young people got vaccinated. It may not have felt it at certain times, but they listened. They listened. I don't know. I think we're doing a great job in teaching our young people about science. I think part of it comes to starting early and explaining like the brain to young people in elementary school. Like that constant conversation about how science works, how science changes, how science, is sometimes working with incomplete information. We do a pretty good job at explaining this, and I think that is helpful. I think sometimes we are great in the college setting because we encourage our students to be critical thinkers and think. They come in sometimes with one opinion about maybe vaccines, and maybe the professor encourages them to think globally about all the other possibilities, and when we do that kind of thing, sometimes it's uncomfortable in the moment, but we maybe win. I don't know. The data suggests some things were working. Also, we can't discount the fact that fear of death is a strong motivator to get vaccinated. COVID-19 caused lots of death, and so a lot of people were personally touched by that, and that can be a strong motivator if you had that personal experience of serious illness or death in, maybe your family or network of people. I think another thing that we have to really think about is our young people are surprisingly conscientious team players. I don't think we give them nearly enough credit or gratitude for that because, they stepped up, and did we thank them? Because, really COVID was not a problem in their demographic group, but they did the right thing. But they worry too much, and we want to make sure that we're thinking about that part. And I think that the worry and the anxiety is also something that can even be at the level of a family member. So in many families, at least for my talking to students, in many families, there were conflicts over vaccination that were very unpleasant. And for the young people in those families, it's so painful for them that, there's this rift in the family over something like vaccination. And perhaps now that we've gotten through the worst of COVID, it's time to, mend fences, and we have to let these things go. Some people are just always going to be vaccine hesitant, and there's nothing we're going to do about that. The other thing I think the data might suggest is that risky behavior obviously will lead to problems in some cases, but risk aversion may lead to mental health disorders if they don't take risks. And so I think we want to encourage our students to really think about, how can I take some good risks? What does that look like for me? We have lots of things built in to the university that help students take risks, like taking ownership in a student organization, going and studying abroad, doing things that are a little scary. We want our students to do that so that we can help them grow intellectually, but I think not only are we helping them grow intellectually, but we're supporting their mental health. I think that both of those things are happening when we encourage people to take risks. And vaccine hesitancy is still a major problem, even though the young people in this particular study most recent study got vaccinated. And the US, 80% of the US population has received at least one dose of COVID-19 vaccine. Only 8%, according to the CDC from like last week, only 8% of the US population has got the most recent updated bivalent booster. So we have a lot of people going into the winter season who don't have the most recent vaccine that'll protect them through the winter season. Also, the US population, only a quarter of them so far have gotten the flu vaccine, and we know going into the flu season, it's gonna be a really difficult flu season because we've been living in masks for multiple winters now, and we haven't been exposed to viruses. We can already see this coming because we can see the pediatric populations, the spread of RSV, and pediatric hospitals are full of kids who just didn't get exposed to all these viruses. They were living in masks, and now suddenly there's the rampant outbreaks. So how do we build trust in vaccination? This comes from Johns Hopkins, and you can go into more details if you want to look at all their real good evidence-based approaches to building trust in vaccination. But one of the things I thought was really interesting to mention is avoid correcting misperceptions. It is the instinct, and especially as faculty members that teach for a living, it is our instinct to say, you're saying something that is completely inaccurate. And so I need to correct you and tell you that your information is bonkers, right? So we want to do that. But when you're faced with someone who's making incorrect false claims about vaccines, the data suggests that that is truly unproductive or counterproductive because it actually backfires. The person shuts down, they don't listen to the message, and in fact, you push them in the opposite way. So how do you deal with these situations when people are like, saying these crazy things? Well, what does work is focus on what you're doing here to prevent disease, provide correct information. You can say, oh, that's an interesting approach or opinion. Let me provide you with this alternative information that, you're trying to prevent the disease. And how that's worked really well, I think, St. Elizabeth in our area showed data of who was in the hospital, right? Vaccinated people, unvaccinated people. And they did lots of public awareness campaigns and showed that, it wasn't the people who were unvaccinated, who were on ventilators, for example, or in the ICU. That kind of information, doesn't really directly dispute the wrong information that some people were holding, but it was convincing them, you can, have a way to really, prevent disease. Focus on preventing disease. Focus on preventing the bad outcomes like landing on a ventilator or something like that. The other thing that works, according to Johns Hopkins details, is that we linguistically want to be careful in assuming that vaccination is normative. Saying things like, of course you'll get vaccinated. You will vaccinate because that's, what you're going to do. And so you're framing the vaccination as default. There's, great work in all kinds of areas, not just psychology, but also in economics that looks at, framing the default option as what you want people to do, and then people just do that. They follow the norm. They're really great like that, and so take advantage of that. Motivational interviewing is another great strategy. Dr. Goddard's in the audience. She can tell you all about that. But basically, you have to, have a discussion with somebody that really takes into account where the person is in that moment, and then actively listen, reflect, ask open-ended questions, ask permission to provide additional information, acknowledge autonomy as a way to strengthen the perception that you're working together on a common goal. Motivational interviewing works in so many places. I've done this a lot of times when I'm talking to a student who's struggling academically. I'm not an expert in motivational interviewing, but you can just take little tidbits here and there, and it even works in other situations. So it's a very powerful tool. It's been rigorously evaluated in clinical trials as a very effective way to, get people to consider vaccination. You have to build trust through empathy. So that's where, again, going back to telling the person that they're wrong is not because you're not building the relationship, the empathy, the connection with the person. So building empathy is really strong, because if the person feels like you're connected to them, then they start trusting you, and then you can make gains in that communication and tailoring the communication. Like the communication for a college student should be different than a person who isn't college educated. Remember that the vast majority of the population is not college educated, and so there are different groups where you have to tailor the message differently, and then communicate often and transparently. I think that's where eventually we got 80% of our population to get vaccinated for COVID, because the messaging was so often, and proactive communication eventually works. Okay, so here's my last slide, and then we can ask questions, talk, give comments. So first of all, I think behavior change is really hard individually and as a society. I thought that's interesting why the data was so different between the two studies, but generally we know that getting people to change their behavior if they're entrenched in one position is really challenging. People don't tend to change very much. And so, we need multiple strategies if we're going to get people to be more accepting of vaccines. That's where the Johns Hopkins list is good, because you need to do multiple things. Also, I think understanding science is pretty difficult. Even in these two studies, things didn't turn out in a way that I would have predicted. And so that's the fun part of science. That's why I love doing studies and doing research, because, sometimes you're just like, that didn't turn out the way I thought at all. How fascinating. So, we learn important things about, new things by doing science, and it's really important that our students are engaged in that work too, so they understand the cool aspect of science and why we do what we do. I think it's also really interesting that the strengths and needs of our college students possibly have shifted fairly dramatically in only a short period of time of like 10 years. It'll be really good to do more research to suggest if that's truly the case, or if it's just a transient thing that is associated with COVID disruption, but it really is useful to look at that young adult population and see if they're really amenable to being team players. Then society is on the road to being fixed if they run it. Like team play, young people who are team players, like this is, wow, like the future is bright, right? If that's true. So we need to know, first of all, if that is actually true, and then how can we capitalize on that. Also, I think COVID was extremely disruptive, but we also met this adversity with significant resilience in higher ed. And we should really be thanking each other, ourselves, our students for being patient. But we did a really good job, and I think we oftentimes don't really tell ourselves that. We are on to the next thing and on to the next thing, and we don't really take a moment and reflect and say, wow, we were really good at handling COVID. We were really good at it. It wasn't fun, but we did a great job. We really did. And we did a particularly great job at NKU. So I think it's important we say that. And then that leads me to opening it up for any questions. I know there's questions that possibly online or in person, or, just jump in there. But thank you, everyone. Yeah. Okay.
I apologize, we're going to have to leave.
Yeah,
I
yeah.
do want to ask a question before
Yeah.
that. So I certainly can't discount any of your hypotheses about why the numbers changed so dramatically over 10 years, but I do have an alternative hypothesis.
Oh, yeah, I want to hear it. Yeah.
So I don't remember when H1N1 was around whether it became caught up in partisan politics the way
It did not.
The way COVID did.
Yeah.
But I know it's always the case that younger people are more liberal, more likely to identify, say, with the Democratic Party than older people.
Yeah.
And so to the extent that partisan affiliation became a marker of whether people would get vaccinated or not, that might be an explanation of why younger people were more willing to get vaccinated.
That's a great question. And you know what? We did not ask on the survey, who did you vote for in the last presidential election or anything like that. And that's the hard part about research. But, we could collect data this fall. We could collect data and ask that question, right? Because that would be, because in our area, like not all our students are
No,
democratic.
definitely not.
Right?
And I wouldn't think that would explain a switch from 2080 to 80/20, but it might explain 10 points out of that.
Yeah,
16 or
right,
something. Yeah.
right, yeah, that's a great point, yeah.
If
Yeah.
you're adding questions, you
Yeah.
maybe could ask something like, did you have a family member die, or did you know someone who died?
Yeah, yeah,
Because I think the way that framing of it, both telling the young people, if you don't get vaccinated, you're likely to have someone in your family die, which is basically what they're saying to an old people.
Right.
Right, so that's a much stronger message than what H1N1 was saying.
right, that's right, and it, like, you know, that personal connection is so salient, like you didn't even have to know someone in your own family who died, you just had to have, yeah, it was really.
Or hospitalized.
Yeah,
like someone who
it was a
had
really
experience.
sad, especially early in COVID, it was so sad, you know, like perfectly healthy people were suddenly gone. Yeah, that's a good point, yeah.
Dr. Marczinski, thank you very much for this enlightening talk, and Ken, your question hit on one of the questions that we had on just what the politics of all this might have influenced it. So,
Yeah,
as with all research, you get to write that last page that says, my research suggests the need for additional research.
that's right, always.
Thanks, everybody, and remind the audience, we'll be back on January 18th for the next 6 at 6.
Great, thanks everybody for coming.